The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host.
And good afternoon. We do welcome you to another edition of Ask the Experts here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez. And in this edition of Ask the Experts, we're going to talk about home health and hospice care. And the man to talk to you just about that is Felix Scannaball with Avatar Home Health and Hospice. Hey, thanks for joining us for another edition of Ask the Experts right here on KSEV. Felix, thanks for coming by.
Thank you. Thank you for having me.
Now, right now, we're going to talk about something that is very important to some of our listeners. But before we do, let's give them a little background about your business so that way they know, you are, of course, very reputable as far as your business goes. You've won a few awards as well, as a matter of fact. So let's just talk about your background and how long you've been in business.
Right. Well, we started Avatar Home Health and Hospice back in 2006. So we're going on 14 years, which seems like yesterday, but during those 14 years, we have helped thousands and thousands of people. We do home health, which includes the nursing. A nurse will visit the patient home, make sure that they're taking their medication correctly, that they understand the disease process. In other words, whatever their ailment is, they walk them through what to expect and what to do. And that is also part of the whole treatment. Will also include physical therapists if needed, occupational therapists, or a speech therapist. Whatever the patient needs at home, we will provide them with those services. We also provide them with a home health aid. And the aid will help them with, if they need help taking a bath, or let's say the patient is using diapers, they will change, the diapers. They will make sure the patient is clean. They will go 2, 3, 4, 5 times a week to the patient's home. Make sure that those daily living activities are taken taken care of. So on the home health side, so they will get the nursing, the home health aides, and the therapist. Now, they will also get a social worker because many of these people need more help than what we can provide. And there's other services provided by the state, the county, or the federal government our patients are not aware of. So our social worker will go there and they will see what they qualify for and what they need. Some people have not only the money to go and buy groceries, they might have the money, but they don't have the means to go to the grocery store. So we help them with that. And then they have a problem cooking, because they live all alone. So in a case like that, we will try to get them into a Meals on Wheels program, and at least they're going to get 5 meals a week. And some people go with less than that, which is a shame. If they need medical transportation, we help them to get on MetroLift, which is a service that will take the patient from their home to the doctors and back. So there's a lot of services out there for senior citizens, and we are that bridge. We help them get those services when they need it. They might also qualify for food stamps or supplemental income. There's a lot of help out there, and people are going without it because they don't know about it. They don't know how to go out there and get it.
And, that's something that is very important for our listeners because of the fact that you will help them. They say, okay, well, how do I pay for all this? It sounds great, but you will sit down and you'll go over their benefits with them, find out their information, let them know what Medicaid and Medicare, and also you work with other insurance agencies as well, and you'll help coordinate all that.
Right. That's the first thing we do. Actually, I got a call this morning on my way to the station, and this lady wanted to get some services for her mom. The lady that called me is in her 60s, so her mom is probably in her late 80s or 90s.
Right.
Now I said, all I need to start the process is your mom's name, her date of birth, and her Medicare number.
Right.
With those 3 pieces of information, we go into the Medicare database and we see what other insurances the patient has, and then we can start the process. What happens after that, I meet with the family or with the patient. I said, this is what you have. All of these services are free of charge, so there's no need to worry about how much this is going to cost me. Number one, our consultation is completely free. 99% of the services that we offer are free to the patient, especially patients that have Medicare. So most of our patients are over 65. So if you're 65, 99% of the time, if you work in the United States, you're going to have Medicare because you paid for it while you were working. So under Medicare, all the services that we provide you with are free. If you happen to have Medicaid, all the services that we're going to provide you are free. And if you have an insurance policy and you're 65 or older, all the services we're going to provide you are free. That happens a lot, Jack. People don't call me because they're afraid that it's going to cost them money. Because if they go to the doctor, they might have a $20 copay or a $40 copay
and stuff, right?
So they're going to think, and they have a very tight budget.
Limited
and they say, how much is this home health thing going to cost me? And they go without the services that are completely free. So I encourage you, if you have any doubts, just call me at 281-703-8050. That is my cell phone. So when you call me, you're not going to be talking to a receptionist or a secretary. You're going to be talking to me directly. I will be giving out my number a few times during the show because it's so important for you to make that first phone call. I know what you're entitled to. And when I say entitled, you really are entitled to it because you've paid for it all your life. So now that you need it, don't be shy. You need services, ask for them. You paid for them, you deserve them. If you need them, you should get them.
And in previous instances, and when we've done these shows, Felix, you've told me that some of your patients, they didn't realize that there were certain things that were covered. Then you told them, they said, oh, really? You might be able to help them and take that worry off their mind. So that is very good counseling on your side. You allow them to know this information.
Right. Yeah, like I said in a previous show, we had a patient that had a private long-term policy. She was going without the care, and she had $400,000 worth of benefits in that policy that she wasn't using.
She didn't even know she could use it.
Exactly. And she was already like 91. And we took care of her like for 2 more years. I think she passed when she was about 93. She didn't use probably over $300,000 worth of benefits.
So she probably could have been using it
for years and years.
And didn't even realize it. So that's why it's always good. Don't assume anything, in other words. So they have to realize that. And what's also good, and we want to mention too, is what you guys are doing when you do your services as far as the nursing, you're following their doctor's orders. So there's not something that you guys decide. And plus, what I also like about it is when your nurses are there, you kind of watch the patients, make sure they're doing fine and everything. And if they see something, they'll let the doctors know, right? To kind of coordinate work with the doctors. Exactly.
So, yeah, we monitor how the patient is doing. We communicate with the doctor. And in many cases, in home health, now we're talking about home health care, in most cases, patients will get better, they become stable, and then we discharge them. And then down the line, 2, 3, 4 months later, a year later, they have another event. Let's say they end up in the hospital for some surgery, or they start feeling bad again. They need us again. They call us. We get together with the doctor. We get doctor's orders, and we start the process all over again. So you never run out of the services. That's another point. People say, well, how many visits do I get? And they're afraid that if they get 20 visits in the next month, they're going to run out of visits down the line. What's going to happen when I'm really sick? You're still going to get your benefits because you do not run out of Medicare benefits. There's a lot of uncertainty out there because people don't know. And when you don't know, you don't act. So when you don't act, you're not going to get better. You're going to get worse. Do yourself a favor and do me a favor, because I do care about our patients. Call me at 281-703-8050. It's a 5-minute conversation. Just give me your name, date of birth. Tell me what's going on with you. That's it. Name, date of birth, Medicare number. I call you back in half an hour. I'll tell you all the services you can get for free.
And also, there are some family members out there who are looking after their elderly parents. As we all know, something like that could be stressful, doing it on a daily basis. And I know at other times we've done this show as well, you brought up the fact that some of these family members get a little relief. They can get out and do a little something on their own. And so you guys are there. So that way that worry is gone. And plus, we all know no matter what type of work we do, especially something as stressful as could be looking after a loved one who may be a little bit ill, we need a little relief from that.
That's more a full-time job. Keep in mind that most people do have a full-time job. Then they get home and they have to take care of their parents or their, somebody, a loved one. And that's where they can use our help, and we can help them so they don't have to do as much. So that's, and it's all free, like I said. Now, in some cases, like case like that, they can say, well, Felix, I need somebody to be here. I would like somebody to be here and be with my wife for 4 hours on Sunday so I could go to church, or I could go someplace I need to go shopping. So in those cases, those services are privately paid, but they are available and they're affordable. So, if you need somebody to take care of your loved one for a few hours, even if you're not in our services yet, you call me and we can set that up from one day to the next one. And it's, relatively inexpensive. And that way you can take care of business while we take care of your loved one.
Or at least just get a little relaxation time at home. And
right.
Just to unwind, as we all need to do every once in a while when things get a little bit hectic like that. And,
right.
And as we've talked before, a lot of your patients are very happy with the services you provide. So, they don't have to worry about just someone just doing it, that they've got somebody that they can count on and trust very much so to take care of their loved one when they need that type of work.
Right. Well, we not only are we Medicare and Medicaid certified, but we have received the gold seal of approval from the Joint Commission. And I know we're running out of time for this segment, so when we come back, and we can talk about the Joint Commission.
Sure.
But very few agencies, actually less than 9% of the agencies in Texas have received the gold seal of approval that we have received.
Right.
So that tells you that if you're with Avatar Home Health, not only are you going to receive excellent care, but you're going to have I'm one of the owners. You're going to have my phone number, which is 281-703-8050. Any issues you have, you call me, and I call you back within half an hour.
And he does answer the phone, because I've had to call him a time or two myself, folks. All right, we're going to step away, and we'll come back more. We're talking about Avatar Home Health and Hospice Care. This is Ask the Experts. I'm Jack Gonzalez. That's Phoenix Calabal, and this is AM 700 KSEV, the voice of Texas.
Do you or anyone you know need help with your daily activities, grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
Welcome back to Ask the Experts. Avatar Home Health and Hospice Care is what we're talking about, and the man take care of that is Felix Canabal. I'm Jack Gonzalez, and I did say hospice care, Felix. We've been talking about your home health and the other great services you provide. So let's delve a little bit into the hospice care you provide for our listeners, in case some of them may have a loved one that may need that as well, too, or for themselves.
Right. The hospice service has to do with the patients that have a terminal illness. Let's say that the patient has cancer, they have been on chemotherapy, they've done the radiation, and the doctor says, we've done this now for 2-3 years. There isn't really much else we can do. The best thing to do is just discontinue services and enjoy whatever you have left. It could be 2-3 months, 6 months. It's normally, the rule of thumb is the doctor thinks that the patient has approximately 6 months to leave. That's the time to switch the patient from aggressive treatment to hospice care. Hospice care is where we're going to take care of the patient at home. They're going to stop the chemotherapy or whatever other aggressive treatment the patient is having. And this is, by the way, this is not only for cancer patients. You're talking about patients with heart conditions, kidney failures, any kind of terminal illness that you
might
have.
require hospice care.
Exactly. You will qualify for hospice. Now, again, hospice, how much is it going to cost you? Nothing. What's the copayment? Nothing. No deductible. When does it run out? It's going to run out when the patient expires. Keep that in mind. Now, the difference between home health and hospice is that in home health, we're trying to get the patient to get better and to become stable. That way we can discharge the patient so they can lead a more normal life without having a nurse and therapist come to their homes. In hospice, what we're trying to accomplish is, number one, get that patient stable. We want to make sure that the patient is pain-free, that he's comfortable. Many times when the patient is in pain and they take pain medications, they might feel nausea, so we treat the nausea. They might get constipated, so we treat that too. So we make sure that the patient is not only pain-free, but is comfortable, that they can sleep at night, and they can be as active as possible under those circumstances.
Right.
And that will give the patient freedom to be with their family, because all our services are given at the patient's home. A lot of people think hospice and say, oh, no, they're going to take my mom to some kind of institution.
A hospice facility or something like that. I mean, they're out there, but obviously with you guys, they don't have to do that.
Exactly. So, they're going to take my mom into a nursing home or a hospital setting. No. The whole idea behind hospice is the patient's going to stay at the patient's home, and we're going to take the service to the patient's home. And not only are they going to get the same services, like, for instance, the nurse and the therapist if they need it, and the social worker, but they also get services like a chaplain. If a patient wants to talk to somebody, and some people choose to have the chaplain visit them. Some people don't want to have the chaplain visit them. They have a good relationship with their minister or their priest, or they don't believe in anything and they don't want to talk to anybody about God or anything like that, which is fine. Right. It's always the patient's choice. We offer you many services. When it comes to home health or hospice, the patient basically chooses, okay, I want this and I don't want that. So we have the social worker, we have the chaplain, then we have the doctors visiting the patient at home, because we don't want the patient now, to a doctor's office and having to wait 5 hours to see a doctor when really the doctor's not going to do much for them. So we send the doctor to the patient's home to make sure that everything is fine. We also have a caretaker to go to the patient's home. The same thing. Give the patient a bath, make sure that the linen is changed. If they have to wash some clothes, they would do some washing, light preparation meals. So we offer all of these services for the patient, plus something that is not offered in home health. We provide the patient any and all the medical equipment they might need.
So you even work with medical equipment as well?
Right. So we provide them with a typical package for a hospice patient is the hospital bed, a walker, a wheelchair, a bedside commode, and a shower chair. So if they need something else, like, say, a table so they can eat in the bed, we provide them with that table. Anything they need as far as medical equipment, we're going to provide them free of charge.
And see, that's why we say to our listeners out there, if you have any questions regarding this, as far as all the services that Felix and Avatar Home Health provides, call them, because there might be something, or maybe you might want to change something with your visit coming up, or maybe you want to ask something. Ask them, let them know, and they'll say, well, okay, we'll look into that for you, and you can work with them and let them know yes or no, or what you can provide out of what they request, correct? I mean, you'll accommodate to what their needs are as you go along, correct?
Of course, yeah. We work for the patient. We don't tell them what to do. We might make a recommendation, and if they say, no, we don't want to do that, that's fine. You don't have to do that. We offer palliative care also, which is doctor will visit the patient at home once a month or twice a month. And then the caretaker service. Our caretaker services are people who have been trained to help the patient at home. They go to the patient's home 2, 3, 4, 5 times a week for 2, 3 hours, 5 hours a day, depending on the benefits that the patient has. There's no clinical, there's no nursing involved there. We do the cleaning, we do the cooking, we go grocery shopping for the patient, we go to the pharmacy, we take the patient to the doctor if they need to, we accompany, we escort the patient to the doctor if they need that service also. This service is also either provided by a long-term policy, by Medicaid, or in some cases, it's private pays. In other words, the patient pays for the services, and that's something that we set up with the patient maybe 4 hours a week or 8 hours a week or whatever the patient needs and can afford. It is very important for them to call me at 281-703-8050. Call me at this number and I'll give you some information. I know that we're running out of time, so we better touch a little bit about this coronavirus that's going on.
It's big news these days. So let's talk about the coronavirus in the last few minutes and how it would affect your services.
What's happening now is that a lot of people are afraid to have the nurse come to their homes because, she's going to bring me the virus to the place. Think about this. If you're getting home health, it's because the doctor wants to keep you out of the hospital. If you listen to the news, they're telling people, stay out of the hospital. You don't want to go in the hospital now. So if you tell the nurse that that's the one keeping you from the hospital, keeping you at home, if you tell that nurse, don't come and visit me, now your chances of going into the hospital
are greater.
And they are the people that have the virus. So that's why they're telling you, stay at home. That doesn't mean keep your nurse from going to your home and doing their job. They're professionals. They've been trained on how to prevent transmitting the virus. So let the nurses visit you and let them do their job. So in the last couple of days, we have received close to 15 cancellations of services. Mm-hmm. And now we're talking to the families because we think that's a big mistake.
Right.
But we have to do what they want us to do. So
and you're saying a mistake is, of course, people say, oh, yeah, you don't want to lose money. And that has nothing to do with it.
No.
You're wanting to make sure that they get, because the medical care isn't going away. They still need that. They still need to be looked at, and very seriously, some of them. So that's why you still have to have that nurse there to see you.
Exactly. See, this is what happens in a lot of cases. Our nurse steps out of the picture because the family doesn't want the nurse to go visit the patient. A few days later, something happens. The patient gets into like in a crisis situation because now you have no one monitoring the patient. So now what happens? Family calls 911. Now, talk about contamination. Now, here comes an ambulance. They're going to put the patient in an ambulance. Mm-hmm. They're going to take him to the ER room.
Right.
And then they might get admitted to the hospital for 2, 3, 4 days until that patient becomes stable, only because the nurse stopped going to the patient's home.
And also the nurses make sure you're telling me that their medication, because some of these patients, let's be honest, everyone, when you get a little bit elderly, you forget things, and then you forget to take the medicine to stay well. And then that's one thing, you've told me there have been instances where your nurses have found out people weren't taking the medicine they were supposed to.
Exactly. Trust me that if the nurse is visiting you, it's because you need it. It's not like, a hobby. It's not somebody just visiting or like a social visit. Yeah, those visits you should avoid as much as possible. But to tell the nurse, do not visit me because I'm afraid you're going to bring me the coronavirus, you're forgetting of how many other things can go wrong with you. It's not only because now we're all talking about the coronavirus. You don't want to get the flu. You don't want to forget to take your medications. You want to make sure that somebody's taking your temperature on a regular basis, and somebody's checking your vital signs on a regular basis. Mm-hmm. All of that is going to go away if you keep your nurse from visiting you. So please do not make that mistake. Exactly. If you're afraid, and even if you're with another agency, even if you're not our patient, and you're concerned about this, please call me at 281-703-8050. That is 281-703-8050. Tell me what your fears are, and we'll talk about them, and hopefully I can point you in the right direction and keep your relatives safe and as healthy as possible at home. And don't let this coronavirus keep you from getting the help that you need.
And before we close, we've been talking a lot about the nurses.
Sure.
And, you're always looking to hire some good nurses. So why don't you put that information out there in case we have some nurses out there looking to kind of earn a little extra money or maybe want to come work for you in general.
Exactly. Well, yes, if you're a registered nurse or LVN, please call me at the same number, 281-703-8050. This week we just completed our training of, we have 3 new nurses on board. I need another 7 nurses or so. So please call me. We've been in business for 14 years. Our nurses make much more money than the standard, the industry standard. So please call me. Do yourself a favor. Do me a favor. Call me at 281-703-8050.
All right, Felix. Well, that does it. Thank you for joining us for Ask the Experts today on KCV. We certainly appreciate it.
Thank you for having me.
You're quite welcome. I'm Jack Gonzalez, and you have been listening to Ask the Experts here on AM 700 KCV, the voice of Texas. That's once again Felix Cannibal with Avatar Home Health and Hospice Care. Thank you for joining us on this Sunday. Have a great day.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.